Chambers. We got a great show lined up for you. Stay tuned. And good afternoon, doctors. So great to see you, beautiful ladies, this afternoon. How are you?
Pretty good. How are you?
I'm doing well. I'm doing well. I have a lot of errands to run a little bit later, but I want to be well in 2022, and I want you guys to be well also. Got Dr. April here. We also have Dr. Angela, who is a medical doctor, a retired medical doctor. She's here to talk about all these things that are going to help us walk in, live in 2022, and be so prosperous. Thank you so much for being here and joining us this afternoon. Welcome to the chamber.
Thank you, Dr. Tomekia. Thank you for having me. I'm excited to be here.
All righty. I want to start off by saying you have had your own journey and issues with health. And so, but you have stayed the course and you're still continuing to help other people. I saw you the other day on social media and you were out and you were walking. We want to walk into this year with so much, not just prosperity, but we want to be physically healthy. We want to be mentally healthy, and definitely talk to us about a lot of issues that we see, particularly in the Black community.
Well, one of the things that is very prevalent in the Black community is hypertension. And it's known as the silent killer because it does this damage over years. And then when it causes end organ damage, that's when you recognize you have hypertension. Um, it's it's
It's so prevalent. It's so prevalent in our community.
Mhm.
Why is that? Is it our diet? What is it that we need to change as a community, as an African American community, so that we won't see so much hypertension?
Diet is important. Exercise. Um, Diabetes, having your blood pressure checked regularly, because it's something that you don't have symptoms until it's too late. And often people present with a stroke or a heart attack. And in my case, I presented with a syncopal episode and hit my head. So it's not anything that it gives you warning. You have to maintain a healthy lifestyle, but sometimes family history. I know that I lived a pretty healthy life. I was active, in shape, ate a pretty good diet, but I had a very strong family history of hypertension.
All right. So we're going to talk about your journey as well. Dr. April and
Yeah.
myself, both of us have gotten into this healthy regimen. Dr. April is into holistic meds. Let's talk briefly about that. Then we're going to go back and talk about your journey as well. Dr. April.
Well, like I was telling Dr. Angela yesterday, I think it's important for us to educate, people on, what high blood pressure is, what hypertension is, what diabetes is, so we can, a lot of people are walking around with these things and they're diagnosed by them and they don't know what they are. And we also talked about being your own advocate. I wanted Dr. Angela to speak to that on, your journey and what happened to you and your health. And that is important to be your own advocate because doctors don't know everything. You have to kind of trust your intuition on what you think is going on with your body. Can you speak to that a little bit?
My journey, as far as being my own advocate,
Yes.
well, it it was a long one. You trust the medical system, and for the most part, it it you know there are a lot of gaps within the system, and a lot of time physicians are overwhelmed, they're overworked. Patients may think that you know that they're the only patient, or they may feel, but for the most part, you can't rely on the system to take care of you. You have to be mindful of, of what's going on with your body and everything that's being prescribed. Because often you're the one who's going to figure out that you're having an adverse reaction to a medication. You're the one who gives the history that determines what the doctor does. Um, for me, I had been on blood pressure medications for quite some time and was having a lot of difficulty. It was compounding many issues. And it wasn't until I started to, become my own advocate that I realized that the medications were causing a lot of problems and that they needed to be changed. And once they were changed, a lot of my symptoms went away. So, in terms of hypertension, what is hypertension? When I first started practicing, hypertension was defined as anything over 160 over 90. Now, when you look at the blood pressure, you have two numbers, one above and one below. The one above is called the systolic blood pressure. The one below is called the diastolic blood pressure. All right. The diastolic is a very, sometimes people will just have diastolic hypertension, and it's just the lower part of the number that's elevated. Essentially, there are two types of hypertension. You have essential hypertension and secondary hypertension. Essential hypertension is primary hypertension, and exactly what causes it, they're still trying to figure it out. Okay, but it has to do with salt intake. It causes, when you have hypertension, it puts a lot of stress on the vessels in your body.
So you said something very important there. You said stress and you said diet again, and it keeps going back to that. A lot of people don't appear to be their own advocate with what you just mentioned. But also there are some people who ignore different things that are going on with their body, and then they wait essentially until it is too late. So we talked about silent killers, but there are also a lot of symptoms to some of these illnesses. So we're talking about diabetes, we're talking about changes in the body itself. Let's speak to that so that we can actually have people to begin to go on the right path to taking care of themselves before it's too late. Because we know if you catch a lot of this before it's too late, there are things that can happen.
Well, some of the things is for hypertension in particular, really, there's not much in the way of symptoms. If you have a family history of hypertension, then it's important that you have your blood pressure checked regularly. And you probably should have it checked every year if you have a family history. Diet and exercise, that will help you with just about every medical problem. But even people who eat well, exercise all the time, develop high blood pressure. Okay, and will less so diabetes. Diabetes, you have type 1 diabetes and type 2. Type 1 usually occurs in children or young adults, while type 2 is more likely to occur in older adults. Diabetes is more insulin. Type 1 is where you don't produce enough insulin. Type 2 is where you're resistant to insulin. Some of the symptoms that you may have is that you may become irritable. You might have increased urination. You may notice that you're having recurrent unexplained infections. You may have problems healing. Some people will have numbness in the arms or legs. They'll start to eat more. They may have fatigue. And so those are the kinds of symptoms that you look out for, but they're not necessarily specific for diabetes. They just let you know that something is not right. And sometimes they're so subtle that we brush them off.
Yeah.
But if you have a family history of diabetes, if you have a family history of hypertension, you should be aware of those things. And rather than wait for the symptoms to develop, you should just be proactive and make sure you get those things checked on a regular basis.
Absolutely. So
Good information.
let's transition and go talk a little bit about self-care, because we know that self-care, relaxation, getting facials, some people think that these things are small, but they're huge in the end. When you just talk about even just taking a walk or going to a comedy show, I heard you mention about laughter. I love comedy shows, things that can actually take some of the everyday stressors off when we're in a time of COVID, some food shortages. A lot of people are dealing with the impact of job loss. Where do we go from here? Even Dr. April, I know that you are big into self-care as well.
Yeah, I mean, I love self-care. I think it's important too. And not only just, hey, going, getting massages or getting your nails done or, things like that. Those are great and important too. But taking some time out to be still, I think that's really important. Having that quiet place to where you can just breathe, practicing meditation, sitting alone, maybe, journaling, writing out, the things that happen in your day, your future goals, your plans. Sometimes it's just good to just sit still and have that moment to yourself, and also sleep. Sleep is a form of self-care. A lot of people don't sleep long as they should, and you wake up and you're stressed and you're tired still because you're not, getting adequate amount of sleep, and that's important for your mental health as well.
Yes, sleep is something that's often underlooked, um, because people don't recognize it. I remember, having the working out, 3 or 4 times a week, 2.5 hours each
Mhm.
time, and suddenly just becoming fatigued and not knowing what was going on. I thought I was depressed. And had a cardiac workup, and it turned out to be sleep.
Mhm.
Um, the other thing is stress. Okay, we don't, we sometimes think of stress as just, something that's we just have to deal with, and we don't recognize the changes that it produces in our body and how it can affect, our future health. And so, some of the things you mentioned are things that will help to relax you. Anything that helps to relax you helps to reduce stress, and that adds years to your life.
Absolutely. And having said that, we have quite a few shows coming up. Our show focuses a lot on mental health. We talk a lot about forgiveness. We talk a lot about, again, self care, getting sleep, getting facials, being able to talk to someone, finding a confidant that you can talk to. In fact, we want you guys to go out and follow us on our YouTube channel, because on our YouTube channel we have some full shows. In fact, I have a few clips. We have funny shows. We talk to guys about what they want from women. All of this does impact our mental health. We know the divorce rate is through the roof, 50% or more. So we love it. Dr. April can speak to it. We talk about positive affirmations. We talk about waking up and just thinking positive and being grateful and having that attitude of gratitude. Speak to that for us, Dr. Angela, because I've seen you out walking and you just smile, and you have a smile that radiates. And so you had a story, a backstory about that from when you were a little girl.
Oh, yes, I believe in laughter, okay, and just, um, smiling. Another underappreciated thing,
Mhm.
just smiling by itself. Um, your body responds to what your thoughts and what you do. So just smiling will produce changes that will help you to relax. And it's almost, it will reset your mind. I always say whenever I'm upset and I'm really, really, stressed, I try to think of something funny, and smiling, and somehow my thoughts shift from whatever that was bothering me to something else, and being appreciative for everything that's around you, being appreciative that you woke up this morning, that I'm able to walk, an exercise. Have an appreciation for the simple things in life. You don't necessarily have to wait for something big to be appreciative. Just having that attitude of gratitude will
Right.
do a lot for your.
Absolutely. Absolutely. And as we move to a close, of course, we always close on positive affirmations. We definitely appreciate you coming on. We want the African American community to really, really grab a hold to this. Start to take care of yourselves. We said be well in 2020, take back your health in 2022,
Right.
that is, and just love on yourself. I love on myself. I go to brunch, I do the pedicures, I do the facials, I do the foot massages, I do it all because it is extremely important. But one really big, and I'm going to play a quick clip from Dr. April. We had a show downtown Dallas, and the show was about forgiveness. And with that particular show, that was the focus. And it also actually leads back to self-care, because forgiveness is for you. It is all tied together, from the mental health part of it, emotional, physical, mental is super important. Take a quick look at this clip.
Showed us today in his interview is that forgiveness is for you, not the other person. So as long as you maintain who you are as a person and stay positive, you will always have someone to come to your rescue, like he did in his case, with helping recovering the damage from his building. Thank you again for tuning in to The Chamber.
So yes, forgiveness. I love it. I wake up every day saying, if you made me mad, I'm over it. I'm done with it. 2022, I am claiming it to be my year. It's not cliche for me. Like I said, we have some great shows coming up. There'll be the full shows airing on our YouTube channel. One is What Men Want. I can't wait. We have a nice lineup of guys. We have a single guy, a married guy, and a divorced guy. They're all going to talk about it. Same thing with the ladies. We're going to have a show. After that show, we're going to have a show, Be Physically Fit and Active in 2022. If you don't want to get out and work out, there's some other things that you can do to stay healthy. And then also, we had a recent sit down, Dr. April and Dr. CC, and we talked about that bad girl, bad boy image. So we're going to actually have a full show on that because relationships are extremely important to our audience. So again, thank you, Dr. Angela, for joining us today. Dr. April, before we go, give us a positive affirmation and we can actually close out.
Okay, so the positive affirmation for today is I release all stress and negative thoughts about my body. I am a vision of good health and vitality.
Okay. I really love the ending, a vision of good health and vitality. Thank you guys so much for joining the Doctor's Chambers today. Thank you for being on our show today, Dr. Angela. We appreciate it. Hopefully we'll see you again back in the chamber. Other than that, we'll be back soon, probably next Sunday or Sunday after that, with another show to help you guys as well. So thank you so much for joining us, and have a great rest of your Sunday.